Hello friend, welcome to my channel Doctor Online 24/7. Today I am going to tell you about diabetes mellitus. In this video we will cover Introduction, Types, Signs, Symptoms, Complications of diabetes, Diagnosis, Treatment, Monitoring blood glucose levels, Preventions. So let's get started. Introduction. Diabetes mellitus is a disorder in which the body does not produce enough or respond normally to insulin, causing blood sugar, glucose, levels to be abnormally high. Doctors often use the full name diabetes mellitus, rather than diabetes alone, to distinguish this disorder from diabetes insipidus. Diabetes insipidus is a relatively rare disorder that does not affect blood glucose levels but, just like diabetes mellitus, causes increased urination. Blood sugar. The three major nutrients that make up most food are carbohydrates, proteins, and fats. Sugars are one of three types of carbohydrates, along with starch and fiber. Insulin. Insulin, a hormone released from the pancreas, an organ behind the stomach that also produces digestive enzymes, controls the amount of glucose in the blood. Types of diabetes. There are mainly three types of diabetes. Type 1, where insulin is completely absent. Type 2, where either insulin formation decreases, or the body is not responding to the insulin formed. Type 3, gestational diabetes. Gestational diabetes develops in pregnant women who have never had diabetes. Early signs of diabetes. Hunger and fatigues. Peeing more often and being thirstier. Dry mouth and itchy skin. Blurred vision. Symptoms of diabetes mellitus. The symptoms of high blood glucose levels include increased thirst, increased urination, increased hunger, blurred vision, drowsiness, nausea, decreased endurance during exercise. Complications of diabetes. Diabetes damages blood vessels, causing them to narrow and therefore restricting blood flow. Because blood vessels throughout the body are affected, people may have many complications of diabetes. Many organs can be affected, particularly the following. Brain, causing stroke. Eyes, diabetic retinopathy, causing blindness. Heart, causing heart attack. Kidneys, diabetic nephropathy, causing chronic kidney disease. Nerves, diabetic neuropathy, causing decreased sensation mainly in the feet and legs. High blood glucose levels also cause disturbances in the body's immune system, so people with diabetes mellitus are particularly susceptible to bacterial and fungal infections. Diagnosis of diabetes mellitus. The diagnosis of diabetes is made when people have abnormally high levels of glucose in the blood. Doctors do screening tests on people who are at risk of diabetes but have no symptoms. Blood glucose measurement. Hemoglobin A1C. Oral glucose tolerance test. Screening for diabetes. It is important to do screening tests in people at risk of type 2 diabetes, including those who are 35 years or older, have overweight or obesity, have a sedentary lifestyle, have a family history of diabetes, have prediabetes, have had diabetes during pregnancy or had a baby who weighed more than 9 pounds, 4,000 grams, at birth, have high blood pressure, have a lipid disorder such as high cholesterol, have cardiovascular disease, have fatty liver disease, have polycystic ovary disease, have racial or ethnic ancestry that is associated with high risk, have HIV infection. Treatment of diabetes mellitus. Diet, exercise, weight loss, In type 1 diabetes, insulin injections. In type 2 diabetes, often medications by mouth and sometimes insulin or other medications by injection. Homeopathic medicines. Diabetes treatment goals. Many things cause blood glucose levels to change. Diet, exercise, stress, illness, medications, time of day, monitoring blood glucose levels, fingerstick glucose test, continuous glucose monitoring, CGM, keeping a record, prevention of diabetes mellitus. Type 1 diabetes. No treatments prevent the onset of type 1 diabetes mellitus. Some medications may induce remission of early type 1 diabetes in some people, possibly because they prevent the immune system from destroying the cells of the pancreas. However, these changes are temporary, and the medications cause side effects that limit their use. Type 2 diabetes. Type 2 diabetes can be prevented with lifestyle changes. People who are overweight and lose as little as 7% of their body weight and who increase physical activity, for example, walking 30 minutes per day, can decrease their risk of diabetes mellitus by more than 50%. Metformin, a medication that is used to treat diabetes, may reduce the risk of diabetes in people with impaired glucose regulation. Thanks for watching. Doctor Online 24/7 by Dr. Sanabawani.